Good morning, Chairman, Co-Chairman, staff and fellow. I am Pisitthisak Wongrapeephan from Phamongkutkaew Hospital. Today, I would like to present the topic of utilization and benefits of the 70-degree lens in shoulder arthroscopy, when and how to use. This present composed of introduction, history, what is different between 30-degree versus 70-degree lens, utilization in shoulder and standard arthroscopic set. In history, Dr. Sorin Nortendorf is the first to use the term arthroscopy in 1912. Dr. Eugene Burcher is the first to use arthroscopy to diagnose meniscal pathology in 1921. Dr. Kenji Takagi is the first to use modern arthroscope in 1931. And Dr. Masaki Watanabe is the first used arthroscope, pulsed light source, and color photograph in 1954. The 70-degree lens was first introduced in 1970 to use the knee arthroscopy. What is different between the 30-degree versus 70-degree lens arthroscopy? The 70-degree lens provides a wider field of view but less image distortion than 30-degree arthroscope. So you can estimate orientation with 30-degree lens, while the visual field of 70-degree lens would help operations such as rotator cuff repair or meniscus root repair. The shape of light projection and view is different between 30-degree and 70-degree lens, as shown in the slide. If you use the 70-degree lens, beware the blind spot in front of the camera. This video shows when you rotate the light source of the 30-degree lens provide a standard field of view and is effective for most routine procedure, offering a straightforward line of sight. And the 70-degree lens has more visual field, but it has a blind spot in front. When you rotate the pose, you cannot see the monitor in front of the lens, but you can see the roof and the floor. The 70-degree lens have the advantage in many areas of surgery, knee, hip, ankle, and elbow, but today we're going to focus on the shoulder. Study from Dr. Beatty, published in Arthroscopy Journal 2010, show that use the 70-degree lens improve visualization include anterior glenohumeral stabilization, distal clavicle excision, coracocavicular ligament reconstruction, rotator cuff repair, and subdeltoid shoulder arthroscopy. After I review the indication for shoulder surgery, there are 5 locations, include subscapularis footprint, base of coracoid, bicipital groove, Bankart lesion via posterior portal, and posterior-inferior rebum via anterior portal. First, subscapularis footprint via posterior portal. In 30-degree lens, we can see only upper part of the subscapularis footprint on a lesser tuberosity. And when we switch to 70-degree lens, we can see the entire footprint of subscapularis on lesser tuberosity. Better field of view. In clinical application in laboratory, subscapularis tear, we have to use 70-degree lens from the posterior portal look at the lower part of subscapularis footprint on lesser tuberosity to more accurate placement of the suture anchor as shown in the video. Comparison, the 70-degree lens better view of scapularis footprint. different camera tilting angle. Sometimes we blind open posterior portal when we use the 70-degree lens. We don't lift our hand too much. When normal tilt of scapula, the 30-degree and 70-degree lens can see the subscapularis footprint. But when posterior tilt of scapula with a limit camera tilting, the 70-degree lens will provide easier health visualization of subscapularis footprint on lesser tuberosity. Study from Dr. Kim published in AOTS 2023 show that 70-degree lens help to see hidden lesion of subscapularis from obscured by STHL when use 30-degree lens. Study from Dr. Richard published in Orthopedic Clinical North America 2003 show that 70-degree lens improve visualization of subscapularis footprint. And next study from Dr. Al-Khatib published in Arthroscopy Journal 2024 show that 70-degree lens provide over-the-top view for subscapularis tendon for arthroscopic augmentation of subscapularis revision repair. And study from Dr. Sadat published in JOCR 2018 retrospective review 70 patients of 58 when rotator cuff repair were late diagnosed isolate partial tear subscapularis footprint when at the 70 degree. He recommend use the 70-degree arthroscope during shoulder arthroscope, recognize of the subscapularis tear. And next, the coracoid base via posterior portal. This video demonstrates the use of the 30-degree lens of coracoid base exposure on the left side compared to use the 70-degree lens on the right side. We will see the better visual for enhanced visualization of coracoid base from 70 degrees from posterior portal. Another benefit of surgeon preview, Dr. Pascal Boileau in 2023, he previewed arthroscopic coracoid base viewing during arthroscopic latarjet procedure. Start by insert guide wire and drill a hole in the bone and cut the bone at coracoid base for latarjet procedure. And next, for bicipital group via posterior portal. This video demonstrates to use the 30-degree lens for bicipital group visualization on the left side compared to use the 70-degree lens on the right side. We will see the better vision for the bicipital group from 70-degree lens from posterior portal. The study from Dr. Chian in Arthroscopic Journal 2016 shows 70-degree arthroscopic and visualized bicipital group 7 mm more than 30-degree arthroscope. If you want to decompress group for transpose the bicep, the 70-degree have the benefit. And next, bank cut lesion via posterior portal. And this video demonstrates use a 30-degree lens for bank cut lesion. Visualize on the left side compared to use the 70-degree lens on the right side. We will see the better vision for bank cut lesion and capsule and glenoid neck pathology from use the 70-degree lens from posterior portal. This is a Perti lesion. Study from Dr. Lai published in Arthroscopic Technique 2021 and Dr. Kanok Loch published in Arthroscopy Technique 2019 show that use a 70-degree lens for improved visualization to glenoid neck of double row bony bank cut repair. Study from Dr. Thamlong Skunsiri published in Arthroscopic Journal 2023 show that 70-degree lens provide single posterior portal technique for arthroscopic bank cut repair. And the last, posterior inferior labrum via anterior portal. This video demonstrates the use of the 30-degree lens for posterior inferior labrum visualization on the left side compared to use the 70-degree lens on the right side. We will see the better vision on posterior inferior labrum via anterior portal. Study from Dr. Duer published in Arthroscopy Technique 2016 at 70 arthroscope from anterior viewing portal visualize the posterior inferior joint capsule which the inferior portion of the torn of posterior glenohumeral capsule. How to find the 70-degree lens in standard arthroscopic set. The 70-degree lens not always available in standard arthroscopic set. Please notify the company to bring the 70-degree lens. Take-home message. Beware disorientation and distortion of the 70-degree lens. Practice using it. It will make you a better surgeon. And second, we should know when we use the 70-degree lens in shoulder via posterior portal such as subscapularis footprint, coracoid base, bicipital groove, and Bankart lesion, and via anterior portal, posterior inferior labrum. And lastly, check available in your hospital and notify the company to bring 70-degree lens if you want to use it. Thank you.